In just a bit, President Trump will address the nationwide opioid epidemic. He's expected to declare a public health emergency, which falls short of a more sweeping national emergency declaration.
After a 60 Minutes Washington Post investigation earlier this month, Mr. Trump said the country has a drug problem and he wants to get the response right.
I did see the report. We're going to look into the report. We're going to take it very seriously because we're going to have a major announcement probably next week on the drug crisis and on the opioid massive problem.
For more on the opioid crisis, we're joined now by Pennsylvania Republican Congressman Brian Fitzpatrick. He joins us from Capitol Hill. Thank you so much for joining us, Congressman.
Thank you, Vlad. How are you?
Good, thank you. So President Trump, as you know, discussed calling the crisis a national emergency, but instead scaled it back to a public health emergency. Help our audience understand the distinction between the two.
Well, public health emergency requires Congress to actually fully, proactively fund the crisis, whereas a national emergency, my understanding is, can authorize the president to disperse already funds that are already in the budget, already in the government coffers. So that's the distinction. Obviously, this is a step in the right direction. We'd like to see him ultimately declare this a national emergency. That's the position that I have as a vice chair of the bipartisan heroin task force. But this is certainly welcoming news that we're going down the right path.
So then what prompted the president to adjust this declaration?
You'd have to ask him that. I don't know. All I know is that we need funds to flow down to the state and local governments and to the communities that are hardest hit. I have a particular interest in this issue because it's really crippled my district back home in the suburbs of Philadelphia. We just need the money flowing down so we can start tackling the problem, not just from an addiction and a treatment perspective, and not just from a law enforcement standpoint, but perhaps even more importantly, from an education and prevention standpoint, because we want to prevent the situation from gripping other members of our youth in our community.
And Congressman, you co-authored a bipartisan piece of legislation that will overwhelmingly, that did pass the House on Tuesday. It's intended to stem the flow of opioids into the United States. Tell us more about that.
So the opioids are predominantly coming from three countries, Afghanistan, Colombia, and Mexico. The fentanyl, which is what this bill addresses, primarily coming from China. That's the cause of a lot of the OD deaths that we're seeing across America. Heroin that's laced with fentanyl, or even worse cases, carfentanil, which is a more potent synthetic opioid. What the Interdict Act does is it provides CBP officers at all borders and all ports of entry, and also at mail consignment facilities, to be equipped with scientific screening devices and also scientists that can interpret results that will prevent the deadly fentanyls from getting in to our country to begin with.
And you're also sponsoring legislation that would restore the DEA's authority to combat the crisis. Tell us why that's necessary.
It's called the Restore Act, and it's addressing what was referred to earlier, the 60 Minutes report from last Sunday. Some action that was taken last cycle obviously caused a lot of harm to the DA's ability to enforce and really go after the pill factories, the pill manufacturers, quite frankly, that have been profiting off of this crisis. So what this does is it restores the DEA's ability to interpret the regulations as such, where they're going to have more ability to investigate and prosecute a lot of the peddlers of these opioids.
You know, you mentioned, Congressman, that your area is just outside of Philadelphia. I actually live in Philadelphia. I'm curious about how you see this opioid epidemic affecting the people that you are representing. What have you been seeing?
The leading cause of accidental death in the United States. I don't know what more needs to be said than that. We're losing an entire generation. And, we get stopped in the street a lot when we're out and about in the community. The overwhelming people that come up to me are sharing stories of a lost child, a lost son, a lost daughter, someone in their family. You'd be hard-pressed to find anyone in our community, and I don't think our community is unique in this. I think there's a problem throughout the country that haven't been touched in some form or fashion by this epidemic. And when it gets to that point, clearly it's beyond a crisis, it's an epidemic, and we really need to get the funding going down there. I want us to get to a point where we declare this a national emergency for sure.
Congressman Brian Fitzpatrick, sir, thank you so much for your time. We appreciate it.
Thank you, Vlad.